All right, good afternoon again. We're delighted to be joined by UNICEF's Middle East coordinator, who is here Geert Cappelaere, who is here to discuss the situation in Yemen, and obviously with a focus on the situation of children. Geert.
Thank you. Thanks so much, Stefan. Colleagues, good morning. Indeed, I am UNICEF's Regional Director for the Middle East and Northern Africa. Very happy to take any question related to children in the region, but the focus today is indeed on my visit last week to Yemen. I spent the last week in Yemen. For me, it was a kind of coming back because I have been serving as UNICEF's representative up to 4 years ago. I have for you 4 key messages from that trip. Overall, colleagues, I think today there is for a child, a boy or a girl, not much worse places to grow up than in Yemen. The situation in Yemen is extremely dire. When I left Yemen 4 years ago, we were already alarmed by the huge caseload of children suffering from the life-threatening severe acute malnutrition. At that moment, we had 250,000 children affected. Today, there are close to 500,000 children in Yemen under the age of 5 suffering from severe acute malnutrition. And severe acute malnutrition is probably one of the best possible indicators how a country is thriving. However, for children in Yemen, it doesn't end there. As you all probably know, Yemen has been hit since the last 5 weeks by a truly massive outbreak of cholera. We have to date more than 100,000 reported cases. More than 40% are children. It's a massive outbreak. We see on a daily basis between 3,000 to 5,000 cases adding to the caseload. We are currently, together with our partners, WHO and others, we are working on a possible scenario that the caseload may go up to 250,000, 300,000 people. The situation is truly dramatic, not only by the numbers. The situation is the more dramatic because the systems that are usually there to prevent or to treat cholera, unfortunately, are at the verge, I would even say, have collapsed. Half of the health system in Yemen today is not functional any longer. Those other half that are still functioning partially are functioning on a zero budget. If it was not of UNICEF and other international partners, there would be no functioning health facilities any longer in Yemen. So you have a massive outbreak with, unfortunately, doctors, nurses, medical staff trying to attend to the cases, but people who have not seen their salary for the last 8 to 9 months. You have health centers who are swamped with people arriving, seeking oral rehydration treatment or seeking diarrhea treatment, and unfortunately these centers are having little or no operational expenditures, no operational budget, have no medicines available. So the situation, that makes the situation even more dire. The last point is that I have left last Friday Yemen also with a feeling of unlimited admiration for those health workers, despite having no salaries, still continue working very hard, working relentlessly. A feeling of admiration for the people of Yemen, and despite the more than a decade of conflict, despite the chronic underdevelopment, people continue to fight for their own survival. However, it is very unfortunate that people also start more and more getting into negative coping mechanisms, and children there again are the first to suffer. We have seen over the last few months the number of girls being offered for marriage under the age of 18 increasing by 20%. The number of boys that are exploited, their labor is exploited and not any longer in school, is skyrocketing. So the situation, that makes the situation only but further dire because of the negative coping mechanisms and children again being the first victims. So in a nutshell, an incredibly dire situation, and I hope very much that Yemen gets even further on the radar of the international community, and as long as there is no peaceful solution in Yemen, I hope the international community will come together and help supporting urgently the response needed to the cholera crisis. Thanks.
Great. Thank you very much. Abdulhamid?
Thank you for the briefing. My name is Abdulhamid Sayam from the daily Al-Quds Al-Arabi. And I have two questions. The first, I would like to hear more from you about the logistics of your trip. Where did you go? How you moved from one area to the other, especially if these areas belong to different power forming in the country. And my second question, normally the UN has this mechanism, what we call naming and shaming. With that human-made tragedy, why you don't pinpoint to those who are responsible for that? Thank you.
Well, thank you so much. I think two very important questions. The first one, I have concentrated myself in those areas where we have seen the biggest outbreaks of cholera. And until last week, the biggest concentration was around the capital in Sana'a city and in neighboring districts. However, since we have reported cases out of 19 of the 22 governorates, we have a caseload that is rapidly increasing in the north, but equally in the south. Your second question, naming and shaming, I don't think a child today in Yemen is helped by naming and shaming. It is not our accountability as UNICEF to name and shame. It is our accountability as UNICEF to call upon everyone to support the response, to call upon all parties who are today responsible for the conflict in Yemen, to call upon all parties who have any form of influence over the fighting forces in Yemen to realize that this conflict needs to stop. Children have suffered enough. 500,000 severely acute malnourished, 100,000 cholera cases. It is simply endless. Close to 2 million kids who not go to school anymore. It is high time that all those who are responsible realize that the country at the verge of collapse, that one of Yemen's biggest assets, its children, are getting killed.
Matthew?
Sure, thanks a lot. Matthew Lee, Inner City Press. I want to ask a follow-up on accountability. I think I understand what you mean by saying that a children is not immediately helped by accountability. But some would say that if you don't actually name those causing the problem, that they continue to do it. So I wanted to ask you, how does UNICEF work with the Special Advisor on Children in Armed Conflict? Previously, the Saudi-led coalition was named as in the annex. It said that there won't be any new listings in the annex this coming time. But does UNICEF play a role in feeding information into that? And will it do the same thing this time? And then you may have seen the story in the New York Times about a UNICEF contractor, Transoceanic, which has been identified as bringing in U.S. commandos military equipment. And I wanted to know what steps UNICEF is taking to protect its own workers and also not become a party to a conflict, to not be working with those who are bringing in military equipment. Mm-hmm. Thanks.
Thank you so much. Again, two very important questions. UNICEF in any conflict zone will ensure on any given time that any violation, any grave child rights violation, is being reported and verified. That is our responsibility. It is up to other organizations within the UN system then to do with that information as they see fit. It is our responsibility to ensure that the information is being shared, that is being documented and verified. Your second question on the contractor, we are aware, we have been made aware of this. Unfortunately, at the moment of contracting, none of that information was brought to our attention. We work with all contractors that can help us getting the supplies where they are most needed. It is very regrettable that sometimes we get post-factum information that may have led to taking decisions differently than the ones we have taken.
But does UNICEF ask prospective contractors to certify in some meaningful way that they're not carrying military equipment for any parties to a conflict? And I mean,
we absolutely do that.
So did this company misrepresent itself to UNICEF?
I think you can conclude that, yes.
Mr. Abadi and then Madame.
Thank you, Stefan. Thank you very much for this briefing. My name is Abadi from the paper Le Dossier. You described a very dramatic situation of children in Yemen. What is, in this regard, WHO doing, and what is it saying right now?
Thank you so very much. We are working very closely with WHO and all other partners who have any capacity to respond to this crisis. So the WHO is making the same noise as we are making around the health situation of children in Yemen. Whatever we are reporting is information that we together stand behind. So in that respect, WHO is very active also on the ground. I could see it with my own eyes when I was in Yemen last week. It's a very close partnership, and that close partnership is very much needed. For the moment, it is all hands on deck in order to respond to this rapidly spreading cholera.
Madame.
Thanks.
Yes, my name is Rebecca Theodore. I represent Caribbean News Service. My question, when you speak about the cholera problem in Yemen, it takes me back to the cholera problem in Haiti. There seems to be some form of similarity. One Haiti, now Yemen. What is the pattern here?
Well, the pattern is a very simple one. Cholera is the spread of cholera is related to infected water resources. Water resources get infected and get not chlorinated, and one of the reasons is because of the conflict, because of water resources that are not accessible anymore for chlorination, and hence the risk of cholera outbreak, the cholera spreading. The second similarity is when you have conflict, it takes time, more time than in peaceful times to get to know the sheer number of people who are affected. There are areas, for example, in the western coastal areas of Thais that are very difficult to access because of the active conflict. So as long as we cannot have access to the population, it is also very difficult for us to respond to the outbreak, and as long as you don't respond to the outbreak, you see the number of cases increasing. Poor sanitation is another reason why it can be spreading so very quickly. So there are indeed similarities, but we have learned from the Haiti situation, and therefore we are there now massively scaling up our response. But our response can only be effective if indeed all parties to the conflict, one, stop the fighting, and second, there is a responsibility in order to start paying health workers their salaries, paying operational budget to health facilities, because UNICEF alone, WHO alone, we will not be able to sustain what we are currently doing.
Abdelhamid.
Thank you. In the past, it had been reported that some humanitarian shipment had been confiscated by some militias. I want to ask you if that happened to UNICEF. Did you ever have an experience where a humanitarian shipment, sponsored by UNICEF had been confiscated. My second question related to this, that the port of Hodeidah, there was an initiative introduced by Ismail Wald Sheikh Ahmed to the parties to be neutrally managed, so to allow massive access of humanitarian shipment into the country. Where do you stand with that initiative, and do you have any update? Because it's related to your work as well.
Mm-hmm.
Thank you.
Thank you so much. Good points. Again, on confiscation of humanitarian supplies from UNICEF, none to my knowledge has ever been confiscated. Second, on the port of Hodeidah, what for us, for the children in Yemen is important is that the life-saving supplies get into the country. And we call upon everybody to ensure that these life-saving supplies get into the country. So it is then up to the authorities to take what is needed in order to ensure that, for us, our focus is on guaranteeing that the children who are dying there on a daily basis get what it is needed to prevent them from dying. The politics, that's up to other authorities to deal with.
Matthew?
Thanks a lot. And it's sort of on the same thing. I wanted, I'm sure you've seen that the Supreme Political Council in Sana'a has said they no longer have confidence in the UN's envoy. And I just wanted, as a humanitarian, do you feel that there's any spillover? I mean, is your access the same as it was before they made that statement? And are you aware of this? Do you have any insight, if you are aware of this? There was a controversy about a month ago about vaccines, expired vaccines that were that the local authorities said they found in WHO. Was that the case? And if so, what's your read on it? Thanks.
Thanks so much. Again, important on the expired vaccines. That's something I'm not aware about. So thanks. Second, on your first question, I spoke on the situation of children on the cholera outbreak with all sides. I spoke with the de facto authorities in Sana'a. I spoke to the Minister of Foreign Affairs, Vice Prime Minister, who was from the recognized government, who was at that moment while I spoke in Riyadh. I have made to all sides very clear what I have seen in terms of suffering of children. I have been extremely clear to all sides what, for us as UNICEF, it will take for us to prevent further outbreaks and to treat the children. Both parties have listened, have acknowledged, and 2 days ago I have had a commitment from the foreign minister of the recognized government that they would be committed to pay again the salaries. That is where we stand. Thanks.
Mr. Abadi, and then we'll close it up.
Thank you. Saudi Arabia is a member of the coalition that bombed Yemen. Despite that, are they providing any humanitarian assistance, including to children?
We have Saudi Arabia contributions through the King Salman Center. The King Salman Center is not only providing support, they are also very active in the operations in Yemen. So, yeah.
Great. Thank you very much, dear.
Thanks so much. Merci.